welcome to Healthwire Media. I'm Sneha Kumari with you, and you're watching our very exclusive interactive session. This week, we are celebrating the World Breastfeeding Week. And for this, we have a very special guest who have joined us for this interactive session to give her insights about the common questions on breastfeeding, and especially during this pandemic, what are the things the new mothers should know about it. So we have a very special guest, Dr. Sumita Ghosh, who is an additional commissioner in charge at Ministry of Health and Family Welfare. Welcome to Healthwire Media, ma'am.
Thank you.
Thank you so much, ma'am, for giving us your precious time. And we would love to hear from you on breastfeeding. So there's a very common question I would like to start with is that during this COVID pandemic, there are a lot of theories and things which people have in their minds. And the most important thing is about the new mothers or pregnancy or, about breastfeeding. And today's topic is related to that only, that can COVID positive mothers breastfeed or not? So regarding that, would you like to share something with us?
Yes, Neha, definitely. Definitely a new mother should breastfeed, and this decision has been taken long back. When COVID started, though the situation of COVID pandemic is dynamic and evolving, but that decision has not changed. A mother, should breastfeed because this is based on evidences that the chances and the potential risks of infection of COVID in the newborn, it's very, very, very less, and hardly there is any evidence. And the benefits of breastfeeding, it far outweighs any kind of potential risks of not breastfeeding, as well as the potential harms that can be caused if breastfeed is withdrawn from the newborn baby.
Okay.
Definitely, it is encouraged. It should be encouraged. Yeah.
Okay. Regarding that, ma'am, there's also one thing that what are the cautions or uphold care or how we should take care of ourselves during breastfeeding months during this pandemic or pandemics like COVID-19?
Yeah, the cautions are now, I think it is quite well defined that there has to be, hygiene measures, and especially the hand hygiene, like frequent washing of hand with soap and water, and if clean water is not available, with sanitizers. That is the first step. Second is the use of some kind of barrier masks. So the better the mask, the medical masks are intended because they prevent the direct droplet transmission. So that is very important, as well as the respiratory hygienes, like covering your nose and mouth while sneezing, or any kind of talking like loudly, or any kind of where forceful expulsion is there. Another thing is, of course, hygiene about the surfaces. That is general hygiene measures, not to be very panicky about it, but general cleanliness of the surfaces we touch frequently. Yeah, these are a few measures, which we must take. Social distancing is a very important measure, but for breastfeeding, of course, it's not possible. So distancing is not a measure. But if the mother is non-infected, and there are other, she has to go out with the baby, then she should maintain distance with others. So that kind of social distancing must be there.
Okay. It is a very common perception since this COVID-19 has started that pregnant women should be very much safe during this time, or so do we need to worry about the effects of COVID-19 on pregnancy and breastfeeding women? It's a very important question people have.
Yeah, it's a very important question, because when a woman gets pregnant, so a lot of anxieties are in her
Yeah.
mind. And of course COVID, now for last 1.5 years we are having this COVID pandemic around us. So I can definitely say yes, pregnancy is a vulnerable period. Any infection during pregnancy actually is not welcome. And COVID, though initially was thought of, but now evidences are there that it affects pregnancy. And when a pregnant mother gets COVID, then of course the pregnancy becomes high risk. There are a lot of risks associated, because the growth of the baby, that may get affected. There may be prematurity, there may be preterm labor, there is maybe growth retardation, there may be even serious consequences like death and all of the baby. And mother's health also is it is definitely affected. Yeah, pregnancy with COVID is a high risk condition.
Okay. So, should you breastfeed your baby if you're COVID positive? Is something I think every common person will have in their mind that what should we do? So, what are your views on that?
Yes, of course, you should breastfeed your baby. See, pregnancy becomes risky, but once the baby is born, it cannot. It is that means the pregnancy has happened normally, so there is no need to worry about that. And lactation itself does not, the risks of vertical transmission from mother to newborn or through breast milk is really very, very, very less. And it is hardly documented anywhere substantially. So breastfeeding is a must, and with due precaution, the COVID positive mother must give the breastfeed, because 3-4 things are important here. One is the evidence that breastfeeding does not cause much infection in the babies. Second is the various multiple benefits of breastfeeding, be it the growth of the baby, physical growth of the baby, be it the emotional and psychological growth, the close contact that the mother and baby establishes during breastfeeding. It's very, very important for the psychological growth of the baby, for the emotional growth. And not only immediately, immediate benefits are there. It protects the baby from various sort of infections like diarrhea, pneumonia. It is seen that babies breastfed exclusively, they are 11 times less prone to die from diarrhea, 15 times less prone from some other infection, and 20% this can be prevented. So it's a definite advantage, as well as the long-term benefits like the psychological, emotional growth, the cognitive growth of the baby. Even it transfers into the future educational achievement, career achievements. The whole life is some way benefited. So breastfeeding is it is the elixir of life, and it has to be there. And the third consideration is that the antibodies the mother may be having, either through vaccines or through infection, that gets transmitted. So it is dually, advantageous that breastfeeding gives the nutrition as well as the protective antibiotics for all kinds of infection, and also particularly for COVID infection. So it's very, very essential that mothers breastfeed, even if positive, they must take precautions. And as long as it is not absolutely impossible for the mother, like she's very sick, or the baby is too premature. So all these things, those are the consideration. Otherwise, the decision making tree takes into consideration the three main things which I have said, that breastfeeding must be done.
Yes. I think this
with
is,
now, yeah,
yes,
another thing I want to say, that
yes,
with
yes.
now vaccination at you
Hmm.
know, as an arsenal with us, and it has been now recommended. Initially it was not recommended in pregnancy, but
Yes,
now, you know, the benefits of it, because of the COVID infection risks in mothers, it has been allowed in pregnancy. And of course lactation though is the, you know, they should get priority.
hmm.
That they should be, you know, mothers should be vaccinated,
Yes,
because that immunity passes on to the babies.
yeah. So I think this information is very much crucial for our viewers who all are watching, and you want to know about this, please note it down that vaccination is very important. So get vaccinated as soon as possible. So last thing, ma'am, I want to take from you is that what are the additional hygiene measures that needs to be continued to breastfeed if you fall sick, along with the other, normal hygiene measures which we take.
Yeah, normal hygiene is very important for normal mothers. Also, for breastfeeding, hygiene is very important. During COVID time, we must be very careful. The mother must be very careful of, washing the hands very frequently, keeping everything, everything very clean and neat, and frequent hand washing, which is advised for otherwise also. And then she should wear a mask. If she's, you know, positive, she should wear a mask, and medical mask if possible. And the masks also should not be reused. Mask uses has also its protocol, that it has to be, you know, cannot be reused. It must be washed, it must be clean, and it must be thrown away once used. And the surfaces whichever is touched, they should be very clean, and often they should be, you know, sanitized. uh, Another thing very important is that, we have to be very careful about the, you know, the milk, breast milk and breast itself. Though it is not necessary that before every feed you wash yourself or anything, but as much as possible you should
Okay.
take daily baths, and keep the breast area clean, and wash it, at least make it clean and quite hygienic.
Yeah.
You keep it.
Yeah.
Yeah.
Yeah. Okay. I think these were some of the questions which I had with me, and like which are the common questions which people have in their mind. So I think there you gave a lot of insights, and our viewers will be definitely benefited with all this important, crucial information from you. So thank you so much, ma'am. Do you want to add something for breastfeeding, as we, as on Healthwire, are using a hashtag that support breastfeeding for a healthier tomorrow? So do you want to add something for breastfeeding week? Anything from your side?
Yeah, this year the breastfeeding, the theme is, you know, the breastfeeding is the about your partnership. I'll read
Yes.
out the theme. Protect breastfeeding, a shared responsibility.
Yes.
And in India, we have gone with a theme which is very, very, very relevant to us, because our strategies are early initiation of breastfeeding, that is within an hour of birth. That is first strategy. Second is exclusive breastfeeding, means nothing else but breast milk for the first 6 months. So, and the third one is once the baby is 6 months old, and then slow weaning, and with complementary feeding, breastfeeding. So these are the three strategies for our babies and our children, which are in all our programs. And breastfeeding is at the core of all our programs. Many programs are there. So this year we have taken one very particularly relevant topic as theme, that ensuring early initiation of breastfeeding in normal delivery as well as cesarean delivery, because, you know, cesarean babies, often the breast milk is withheld from them for till the mother. So it's not necessary. We can start and early breastfeeding has the advantage that the natural rooting reflex, the natural reflexes take over, and the baby takes to breast very easily. The more you delay it, so breast milk let down reflex of the mother and other things, it delay and it might be problematic. So our theme is ensuring early initiation of breastfeeding in normal and cesarean delivery. We want to promote that this year.
Thank you so much, ma'am, for giving us such important view on breastfeeding. So thank you so much for joining Healthwire, and thank you so much for giving us your time. We would like to end it.
Thank you, Sneha. Thank you, for giving me this opportunity to talk on a very, very important and very cost-effective and very, very simple intervention which saves millions of lives.
Right. Okay. Thank you so much, ma'am.